Good afternoon, everybody, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have 89,484 lab-confirmed cases, 1,956 new cases reported today, 1,109 people in the hospital, and sadly, 1,552 people who've died. The loss of a loved one from COVID-19 can be a difficult and lonely journey, and our prayers are with all of you. As the summer rolls on, I know many children and parents are talking every day about what will happen this school year. In the spring, when this pandemic first broke out, we made the difficult but necessary decision to close in-person learning at K-12 schools and move to remote learning. March feels like a long time ago given everything we've been through. And that was just the beginning of a series of tough decisions to slow the spread of COVID-19 that have helped our state cope and prevented our hospitals from being overwhelmed. The reality is that the disease continues to spread throughout the country, and some states are seeing their hospitals fill up. But the good news is we now know more about how to slow the spread and how to protect ourselves. After working with health experts, school superintendents, teachers, and more, we plan to put those protections in place and open our schools in a careful way. Today we announced that North Carolina schools will be open for both in-person and remote learning with key safety precautions to protect the health of our students, teachers, staff, and families. This is the Plan B that we ask schools to prepare. It's a measured, balanced approach that will allow children to attend but provide important safety protocols like fewer children in the classroom, social distancing, face coverings, cleaning, and more. As a part of this plan, we want local school districts to provide for remote learning options for any child who chooses it. In addition, school districts will have the option of Plan C, all remote learning, if that's best for them. Now, I know parents and students and teachers have questions about what school might look like if they attend in person. I want to share more information about some of the requirements for schools under this plan. So, face coverings will be required for every teacher, staff, and student from kindergarten through high school. The studies have shown overwhelmingly that face coverings reduce disease transmission. To help, the state will be providing at least 5 reusable face coverings for every student, teacher, and staff member. And we've already delivered a 2-month supply of thermometers and medical-grade equipment for school nurses. Schools will be required to limit the total number of people in the building so that 6 feet of distancing is possible, for example, when students are seated or in a line. Districts and schools can use a plan that works for them, whether it's alternating days or weeks or some other strategy. Symptom screenings, including temperature checks, will take place daily before children enter the school buildings. Schools must create a way to isolate students who have symptoms to ensure that they can get home safely. Schedules must allow time for frequent hand washing, and schools will regularly clean classrooms, bathrooms, buses, and equipment. Teachers will work to limit sharing of personal items and classroom materials. Non-essential visitors and activities involving outside organizations will be limited. In addition to these and other requirements, schools are strongly recommended to implement other safety precautions, such as one-way hallways and entrances, keeping students in small groups that stay together as much as possible, eating lunch in the classroom if the cafeteria won't allow for social distancing, and suspending activities that bring large groups together like assemblies.